Let us learn about the pathology of anus and the various endoscopic findings. Here is a colon, normal rectum, and what I'm going to do is I'm going to show you a normal rectum and anal canal and show the pathology so that you can appreciate the pathology better by comparing it with normal. I want you to focus on the anal canal. Anal canal is smooth, and here you will see anal fissure, that is a deep tear of the anal canal. When patients with anal fissure present, they present with severe pain, and maybe they will say, I had a lot of constipation. I tried to force myself out to empty my bowels, and the bowel movement came out with a streak of blood, and I had a lot of pain since then. So anal canal fissure or anal fissure is one of the most painful conditions. So now let's go back to normal. And in patients who have had anal fissure and in the past, they may have a telltale sign of a sentinel skin tag. That is the sentinel skin tag. And a sentinel skin tag has no pain. Let's go back to normal. And I want you to focus on the dentate line. And here, sometimes you can see hypertrophied anal papillae. These are white, pearly white structures at the dentate line, just projecting in. And these are not precancerous, and most of the time you could just leave them alone. Next, let's look at normal, and let us focus on the hemorrhoidal plexus. Hemorrhoidal plexus are normal vascular structures in and around the anal canal that have an important function, and they form the cushion, like a pillow-like cushion, and are helpful in maintaining continence. When the veins become bigger and are above the dentate line, they are known as internal hemorrhoids. And when they are below the anal canal, they are known as external hemorrhoids. So internal hemorrhoids are above the dentate line, and external hemorrhoids are just outside the anal canal. Next, let's look back at normal and learn about rectal prolapse. And as a rectum prolapses out, this is partial, and when it also shows muscle involvement, and it is total. So partial, total. So we have gone over some of the conditions involving the anal canal, and let us look at when we do a clinical exam, what findings will you see? Here is a sentinel skin tag. Sentinel skin tag, and that's the sentinel skin tag that you see before you put the scope in and take a picture. Let us talk about anal fissure. Anal fissure is a tear in the anal canal, and this is a deep tear of the anal canal, probably chronic. Usually acute anal fissures tend to be a little bit superficial, not necessarily this deep. Now let us look at internal hemorrhoids. So these are the internal hemorrhoids, And when you actually go into the scope, go in with the scope, above the dentate line, you will see these vessels, and those are internal hemorrhoids. They're best seen on retroflexion with the scope. And unfortunately, I don't have that image to include here, but it's something to keep in mind. Now let us focus on external hemorrhoids. External hemorrhoids. And you can see there is a big external hemorrhoid coming out of just outside the anal canal. We also learned about rectal prolapse. And here is the rectal prolapse with the rectal mucosa seen. And this is an indication of a very weak anal sphincter, and the rectum has prolapsed out. So we have learned about different conditions affecting the anal canal. We looked at what is normal, anal fissure, sentinel skin tag, internal hemorrhoid, external hemorrhoid, anal prolapse, or rectal prolapse. I hope this is useful. Thank you.